Hi, thanks everyone for being here. I think it's really important for us to start any dialogue with shared ground. And what I know in my heart is that we all have the same goal. We all have the same goal of optimally protecting our children and keeping our children in school as much as possible as we combat the dual pandemic of COVID-19 and mental health crises. And so it's really critical that we do everything in our power to keep children in school. And again, we have the shared goal of doing that. Um, and so I thought it would be helpful for us to take a bit of a step back. Sometimes we lose sight of the forest for the trees. And I know that we're all exhausted. We are all so done with COVID. Our staff are exhausted here at the health department. But unfortunately, we are at record level highs. And so if we think about what's happened, taking again that small step back, in the United States, 57 million people have been recorded as having COVID. 827,000 people have died. It is the third leading cause of death behind heart disease and cancer. We're not talking about the common cold. We're not talking about flu. We're talking about a disease that has killed 827,000 Americans. And then when we think about our children, yes, we have to be absolutely transparent that COVID is far less deadly for our children than it is for our adults. But over 80,000 children have been hospitalized in the last year and a half. 80,000 children. Just now, over this week, I'm sure we've all heard the reports of pediatric hospitals reaching record numbers of children hospitalized with COVID. We've had over 1,000 children die of COVID. And if we compare that to a bad flu year, we may see about 200 children pass away with flu. And that's a bad flu year. Some years we don't see anywhere near that. So I think it's really important for us to just keep in mind the impact that COVID-19 has had on our community. The good news, though, is that we have strategies that we know work. And when we're looking at our schools, we know that there are good data. We have MMWR, so Centers for Disease Control, morbidity weekly reports that have showcased that schools that implement universal masking have far fewer outbreaks, 3.5 times fewer outbreaks than schools that don't. But more importantly, the incidence of COVID is much lower in those schools. And again, those are studies that are available to anyone who chooses to look at them. And so I think that it is, again, really important for us to all understand we are all doing the best that we can to protect our children, to protect our teachers, to protect our school administrators, to protect our bus drivers, all of whom are doing what we need them to do every day, providing safe, nurturing environments where teachers and parents can partner to help children reach their optimal potential. And I know that we all have that shared goal, but we might be looking at things a little bit differently. And I think that one of the places that we look at things a little bit differently is the mask issue. And so I just, again, want to kind of take a step back and look at what masks are. When I wear my mask, and again, this is based on lots and lots of documentation, and more importantly, 2 years of experience now. When I wear my mask as an individual, am I protecting myself a little bit? Yeah. But much, much more importantly, when I wear my mask, I am protecting everybody around me. Because even though I've done everything that I can to minimize my risk, I'm fully vaccinated, I wear my mask where I can, those are the things that I can do. Omicron is so contagious that we're seeing people who are doing everything in their power to be protected still get the disease. And when I wear my mask in that rare situation where if I were to get COVID, and thankfully I haven't yet, but if I were, when I wear my mask, I'm protecting everybody around me. And so I think that we've spent a lot of the last year and a half talking about individual rights. And when I think about a mask, and I've said this before, I view it as a symbol that I care about the people around me. I'm wearing my mask to protect the people around me. And when we think about schools, we think about our teachers who may be immunocompromised. They've done everything that they can to protect themselves, but maybe they're immunocompromised. We think about children who have siblings at home who aren't yet old enough to be vaccinated, or a parent who may be pregnant. There are so many reasons why universal masking in school systems remains one of the most important things that we can do, not only to protect children, but to protect everybody. And so I really encourage us, our educators are amazing at creating safe and nurturing environments. Our children are resilient. If we teach them, and I'm sure so many parents and educators are doing this already, that wearing a mask is an act of kindness, they understand, they know, and we're social beings. We are built to care for each other. And that's what a mask does. It shows people that we care for each other. And so with that, I'm happy to answer any questions, but I just want to throw my full support for our school districts that are following the current rules, which require universal masking. I cannot state that strongly enough. The current rules require universal masking in school settings. And I strongly encourage all of our school officials, our teachers, our parents to continue to promote universal masking until it's safe for us to resume closer to normal behavior. So with that, I'll open it up to any questions.
Any questions for Dr. Morrow today?
And just for, if anyone's thinking about any questions, just for the most updated information, today we had reports of over 550 new cases reported, and the positivity rate for the testing event that we did in Salem was 35%. So of the people we tested, 35% of those individuals were diagnosed with COVID. So, we are in the midst of an extraordinary surge.
Dr. Morrow, have all of the people that got tested this week at the Salem clinic, have they already been contacted? I know you said that 35%. Was that from this week's or was that last week's?
That's this week's. Last week's it was about 25%. There was a technical glitch for about 40 individuals' test results that were delayed. Everybody else should be in the notification process, but there was a small glitch with the lab where there are about 40 results that are still pending. We should have those by noon, so we'll start that notification process as soon as we get them. And I thanks for bringing up that question. I want to also just share that this is really, our local testing has really been enhanced by the Fralin Center, by Fralin Research, and I just botched that name, but our partnership with the Fralin Labs has really helped us provide the service to the community. So I thank the whole Fralin team for helping protect our community at this time. And so there's a question, share my thoughts about the Roanoke County School Board's vote to remove the mask mandate if and when Governor-elect Glenn Youngkin revotes the public health order. I think that from a general perspective, my job as a local health director is to assure the conditions in which people can be healthy. What we need to do across the board, and certainly within schools right now, is have our multi-layered approach. Vaccines, while imperfect, are the best tool we have. Masking is an extraordinary tool that we have. Physical distancing when indoors is a tool that we have. Contact tracing, case investigations, testing, these are all tools that we have. And unfortunately, we're in the middle of a huge storm. And with that storm, we need all of the layers of protection. So I would say strongly, without doubt, now is not the time to take away any of those layers. We know the impact that COVID has had on our communities and that it will continue to have. And we need to use all of the tools that we have available to us until the community transmission rates go down to a safer level. And we are nowhere close to that at this point.
Dr. Morrow, one of the comments made by one of the board members was that the CDC is not the fourth branch of the government. How would you respond to that?
Is not the, I'm sorry, was that the enforcement branch?
Yes, that's what their comment was. The CDC is not the fourth branch of the government. How would you respond to
Oh,
that?
fourth branch. Well, the Centers for Disease Control is part of Health and Human Services. It is an advisory board. Yeah, I'm not an advisory board. It's an advisory organization as well as an action organization, as well as a financing organization. These are experts who have the most experience collectively and whose sole purpose is to protect and improve the public's health. There is no agenda, and I understand that other people may have different opinions, and I understand that, but I think that it's important to remember that the goal of the Centers for Disease Control is to help, is to assure the conditions in which people can be healthy. So it's not the fourth branch of government, but it is our place where people with the most experience and expertise in this live and work. And I think that it would be dangerous not to very, very seriously consider implementing their recommendations. I think that the reality is they set the bar, and it's up to us to reach that bar. There's another question. As more students get vaccinated, will masks in schools always remain as important as they are? Clearly, our vaccinations are just one of the layers. And one of the things that we need to be aware of, and again, our educators and our parents know our children the best, right? And we can never undermine that. What we know is developmentally, children are at different places. So a 5-year-old may have more difficulty adhering to a mask recommendation if they've had disease and they're coming back, or if they're on quarantine, looking at that shortened period. They're more likely to not be able to adhere to all of the different layers. And so while the community transmission rates are up, I think regardless of the vaccination status, we're going to need to continue to have universal masking. And again, if we think about it not from an individual right perspective, but as the opportunity to teach our children that their actions can protect their teacher who may be immunocompromised, I think that until our community transmission rates drop significantly, where we can start letting go of one of those 5 layers of protection, we should consider having universal masking, regardless of vaccination status, for all of the reasons that we've talked about. But again, I want to be clear that right now, we're in the middle of a massive storm of COVID. And so we need all of those layers of protection. Once we get to the other side of that storm, whatever that looks like and whenever that will be, then we can start peeling away some of those layers. But we're not there. We're just not there. Not with record numbers of children being hospitalized every day.
Dr. Morrow, this is Dave Seidel from Radio IQ. You've said in the past that you have weekly calls with the school divisions, with the superintendents. What are those conversations like? Is it becoming harder to kind of keep them convinced of the precautions, or are they worried about, their staffing at levels and student levels?
I think, I always hate to speak for someone else. I have been so impressed with the school superintendents and their absolute devotion to providing education to our children in the safest manner possible. I think everybody's worried about what the future holds right now because we're living in such uncertain times. But one thing that I can say with absolute certainty is that our school superintendents and our school nurses are so devoted to caring for the children that they are responsible for in the communities in which they live. And so our discussions haven't been hard in the sense of that we're seeing things differently. I think they're hard in the sense of how do you continue to do what our shared goal is, when we've had a situation that's been as politicized as it is, I think we all, and everybody on all sides wants the same thing. We want healthy, happy, educated children who have the opportunity to meet their potential. And we may look at different roads to getting there, but we need to come into every conversation understanding that we all want the same thing, and that is healthy, happy, well-educated children learning and growing in the safest environment possible.
We have time for one final question.
Hi, this is Lindsay Kennett from WFLS.
Lindsay, you might want to type it in. We'll give you just a minute to type it in.
And Lindsay, if for any reason you're having technical challenges, you can always reach out to Christy or myself, and we'd be happy to answer your question offline. Okay, well, I'm not seeing any other questions in the chat. Thank you all. You are all important partners in this. And I think my last words are just, you know, we are in this together. We have the shared goals, and we just need to keep working together to try to find that common ground. And I'm really, really thankful for the relationship that I have with our school superintendents and our school nurses. We have amazing teams out there working with our children. So there's a question about Governor-elect Youngkin, and I don't know. It would be, I think, foolish for me to try to predict what's going to happen. I think we need to ask Governor Youngkin's transition team about those questions, but thank you very much.